Assalamualaikum warahmatullahi wabarakatuh to our lecturer of Analytical Chemistry 1, Dr. Muhammad Idris bin Saidin. My name is SALINA binti YUSOP. My group consists of 3 members, which is myself, Noor, Nadiah and FATIN MURNIRAH. We will explain about the application of titration in our daily life with the title Drug Dose Determination. What is drug dose determination? Drug dose determination is a way to determine the optimal drug dose, the effectiveness of the drug on different dosage level. As we know, every human or subject or individual have different kinds of body or types, so we all might be respond to different dosage level. This will be explained more by our group mates, which is Noor, Nadiah, in methodology. The process that can be used to determine the drug dosage level is called as drug titration. Drug titration is a process involved of adjusting of medication of the dose for maximum benefit without adverse effect. Example of common drug types that requiring titration is insulin, anticonvulsant, blood thinner, antidepressant, and sedative. The experimental drug is given to the individual in increasing dosage until the side effects become intolerable. For example, individual A is a psychiatric patient, so she has to take the antidepressant medication. So at first, the doctor will give the lowest dosage of drug, such as I say like level 1 dosage. So if the patient doesn't respond or still become depression, so the doctor will give another dosage, the higher dosage. This is the meaning behind the increasing dosage. The process on finding the suitable dose is called as dose ranging study. There are 4 objectives on doing this drug dose determination. The first objective is to determine the optimum dose range of the clinical trials and the safety and effectiveness of this drug to the individual patient level. So the next objective is we must ensure that the drug given is not harmful and give any bad effects to the patients or individual. Next objective, which is the third one, is to provide the information on the cumulative effects of the drugs. And the last objective is to determine the dose ranging relationship, safety, and efficacy of the drug. By looking at these 4 objectives of drug dose determination, we can say that this experiment is not only focusing on giving the different dosage level at the patient, but also to ensure that the patient will not giving any bad effects or the drug cannot be any harmful to the patients. That's all from my explanation. This explanation we will continue by our next group members, which is Noor, Nadiah. She will explain on the methodology.
Assalamualaikum. Hi, my name is Noor Nadiah binti RAMLI with matrix number D2019108843, and I will explain about the methods and the results. There are 2 types of commonly used technique or process on determining the suitable drug dosage for an individual, which is parallel type and titration type. And our group choose titration process. Titration process mainly used to determine the dosage, especially for insulin, anticonvulsants, antidepressants, and sedative. The developer of these methods have been used many kinds of drugs from year 2013 until 2017. This is to identify the number of approved dose regimens for each drug and the number of the drugs with a response-guided titration dosage regimens. Response-guided titration is defined as a titration schema based on the individual patient's therapeutic response. All subjects are taking lowest dose of the drugs and the subject's condition will be observed. For those subjects who respond on the low drug dose, they will stay taking that dose. This means that the patient disease suitable and can be cured by the lower drug dose. The other subjects who do not respond will receive the next highest dose. Variation of titration include placebo group. The main goals of the drug dose determination is generally to achieve the highest dose tolerated to maximize efficiency just as to prevent death. Next, based on the results given, we can see that the most of drug approved one dosing regimen, whereas a minority of drugs had 2, 12%, 3, 5%, and 4 or more 7% approved dosing regimens. Drugs with more than one dosing regimens approved were most frequently indicated for treatments of metabolic or endocrine disorder, and 14, cardiovascular or renal disease, and 7, neurological condition, and 5, and gastroenterologic condition and inborn errors metabolism, and equals to 5.
Hi, my name is Noor MURNIRAH. In this experiment, we analysis based on FDA new drug approvals because so far belum ada comprehensive analysis of response guided titration sebagai pendekatan untuk rawatan secara individu. Within 5 years to determine to extend response guided titration is used in drug development and included in labeling. First, sebilangan kecil of drugs yang dipersetujui from 2013 to 2017, which is 22%, included more than one dosing regimen dalam pengambilan label ubat. Second, mostly drug yang dianggap senang menerima respon guided titration mempunyai maklumat titration based on the labeling. Third, for drugs in which response guided titration is described in labeling, slightly more than half, which is 53%, mempelajari pendekatan respon guided titration dalam ujian keberkesanan penting. The overall low rate of response guided titration is not surprising, memandangkan kebanyakan new drugs yang dipersetujui dalam jangka masa yang dinilai 105 dari 181, which is 55% drugs dianggap tidak boleh diterima oleh respon guided titration. Walau bagaimanapun, analisis ini menunjukkan bahawa hanya 39% of all drugs yang terbukti untuk keadaan yang dianggap sesuai dengan respon guided titration have information in their labeling about respon guided dosing. Respon guided titration was most common for drugs yang diguna dalam perawatan gangguan metabolik dan endokrin, for which biochemical parameters are commonly used in clinical practice for patient monitoring. However, there are several disadvantages of use of response guided titration in clinical drug development, which is there are increase in clinical trial complexity, rasa kurang selesa pesakit, lack of validated biomarkers that are indicative of drug effect, and the individuals of patient may exhibit spontaneous improvement or the drug may have some cumulative effects during the treatment process of disease. In conclusion, titration studies provided information about the sequential and cumulative effects of the drug at various dose levels and used for the long-term prescriptions. So, early in drug development, careful consideration should be taken as to whether a new drug under development is susceptible to response guided titration as an approach to reducing significant interpatient variability. If so, for incorporation into efficiency trials, clinical trials design that test this approach should be considered. That's all from us.